in the knowing. Someone said in the book that people perish due to lack of knowledge. And someone said again that what you don't know will kill you, but what you know cannot kill you because you have knowledge. So it is important for you to get knowledge, because when you get knowledge, you have life. One of the people I'm eagerly waiting to hear from, but one of the Mr. Derek Mbuga, that is the Executive Director of Mental Health Uganda, who said that there's so many challenges with health. And he said that the peak of COVID-19, yes, mental health clinics at regional referral hospitals were turned into COVID treatment centers. I think it's one of the reasons what sparked off mental health challenges, because instead of treating mental health, we were treating and focusing on COVID-19, and surely registered some great results there because it didn't have a great impact on us as opposed to our friends away or maybe in other countries. It was because of the much effort that was injected or that was exerted by the Ministry of Health there. So today we're tackling a lot, we're unpacking a lot. Today we're waiting to hear from the report, because we need statistics. Once we get the statistics, then we can know how to come against or how to handle this becoming or this simmering surmountable challenge of mental health challenge. We're talking about 14 million people having a link of mental disorders in Uganda. 14 million, that's quite big, man. That is too big. So we're waiting to see what is the way forward by government. How much is government going to allocate? Are we having more hospitals or more normal hospitals? Are we constructing more stuff or we are not? So those are some of the challenges that we are going to see. Normally, we are waiting to see what are the solutions. Now that we know the challenges before us and it is insurmountable, but what is the way forward? What are the solutions? Do we need more regional referral hospitals, or we need to turn our guns to how can we stop the causes of mental challenges?
I think this report is something that we've been looking forward to generally. This report has everything that we need, because this report should be able to tell us why are Ugandans hiking, why is there a spike in the number of mental health related illnesses in the country. This report should be able to give us details in different regions on what particular diseases that are affiliated to mental health that Ugandans are mostly incurring to. This report should be able to give us a way forward. This report should be able to let us know that this 1% that is being sent to that is being funded to the mental health sector, is there an increment now that we have realized that there's a spike in the number of mental health cases in the country? Is this 1% going to be increased? Is Ministry of Health now going to put more focus on mental health sector in the country? Now, these particular wards that were turned into COVID wards during COVID-19, which I've seen Butabika come out multiple times and claim and say, people, we need to open them back and turn them from being COVID wards. Now that COVID is no longer an issue of international emergency, we should turn them back so that we have them back as mental health wards like they used to be. Has this been done? And if it is done, is there going to be significant effort and significant change in the mental health cases in the country? But I also think, Chintu, that all this done and said is not going to end the grappling issue of mental health cases. If at all unemployment, one, is not worked on in this country, if at all the illiteracy levels are not worked on in this country. These are some,
because again those are the triggers of teenage pregnancies we've been talking about.
Because they are like on top. You know, when you pour fuel in water and then the fuel just stays stagnant on the water. Now you're picking onto that fuel, amafuta gagali kunguru, amazi agali wansi. The real issues, the underlying issues of why Ugandans are facing mental health challenges are the ones that they should give us ways on which we are going to mitigate. That not done, I feel like we shall keep on opening mental health units. We shall keep on increasing the number of psychiatrists in the country. We shall
thank you very much. Good morning, everyone.
We shall all of that, and it's still.
My name is Francis Iwa. I am the co-founder and executive director of Care and Assistance for Forced Migrants. In short, it's Disciplinary in terms of humanitarian work, development work, but also evidence-based advocacy, in other words, research. And part of our humanitarian work includes protection. Mental health and psychosocial support becomes key if we are to leave no one behind. We are to address all the issues holistically. We believe in the SDGs on partnerships. It basically means that if we do not anchor our work on partnerships, as we demonstrated this morning, even the 16 SDGs that we want to make, not do it alone. We saw when we tried to clap with 5 fingers and 1 finger, what happens. I also happen to chair a humanitarian platform for local and national organizations to bring to commitments, especially on localization, as this room demonstrates that there's a lot of capacity. Our biggest challenge is how we coordinate amongst ourselves to ensure that we maximize impact resources that there are. And when it's human, it's logistics, it's your knowledge is everything. So I am very happy that we are part of this celebration, the World Mental Health Day today. A right, then you cannot derogate any. And I think mental health is a starting point, because then we are going to be making very informed decisions.
Thank you very much, Kafomi. We're doing very well. You belong. And You Belong will be followed by Refugee Law Project.
Good morning, everyone. Kenneth Yesiga is my name, and I'm an occupational therapist working with You Belong Uganda. I'll briefly talk about You Belong Uganda and Subuga Grace. Briefly talking about an NGO that works in partnership with the Butabika Hospital and the Ministry of Health. And mainly what we are doing, it is strengthening the community mental health system in Uganda. Long-term program which focuses on reintegrating the ready to discharge patients admitted at the Butabika Hospital back to their families and communities. As Dr. Nak mentioned, that the hospital is extremely full. Persons who are ready to discharge back to their families and communities. And we have another program which is called Escape You. It is strengthening care in collaboration with persons with the lived experience of. This program, we are partnering with the Ministry of Health and again with the Butabika Hospital. It is a cluster randomized study and being implemented at 3 levels. At the primary health center level, and what VH community level, we are training VHTs in mental health that they can be able to identify and refer persons with mental illness to the primary health centers. At the primary center, training health workers who are assessing, diagnosing, and treating persons presenting with symptoms of mental illness. And at the family level, to support to the family and the persons who have been diagnosed with mental health conditions at the primary health center level. And the study is being implemented in Kampala, and in this study we are working together with persons with the lived experience of mental illness at all levels, VHT level trainings, and also the training of the primary health workers. And my colleague here, Grace, is going to tell us, to share with us how that how they are being, the kind of work they are doing in that.
Sorry, just a minute. I'm sorry, at the repeat to 3 minutes because we have a guest of honor coming, and we may not be able to share everything that you have to share, if you don't mind.
We are requesting for only 1 minute.
1 minute.
Good morning to you all. My name is Nsubuga Grace, and I have lived with psychosis for 29 years. I met You Belong in 2020 after being admitted at Dr. Pika Hospital. I was You Belong program, and I educated about mental health. I was also taught on how to adhere to mental treatment. I was taken home after being treated, and to support me toward recovery at Katadi. Since 2022, I have been working with You Belong as a Escape You facilitator. We together support families illnesses toward recovery. We have been training village health teams on how, together with the primary health workers, on our the right to mental health services at all levels. I want to thank you all for listening to me. May the good
Thank you very much. The protocol duly observed. My name is Subi Aquila Anderson. I work with the Refugee Law Project. I'm from the Refugee Law Project. I work with the Refugee Law Project, and the Refugee Law Project is part of the School of Law, Makerere University, and we are based in Old Kampala. We have 5 thematic programs in migrants and hosts. Our 5 thematic programs are access to justice, where we support forced migrants access justice through adult terms of court representation. We also have gender and sexuality program that offers psychosocial rehabilitation to survivors of gender-based violence. We have conflict, transitional justice and governance. Societies to come to terms with past legacies of conflict. Then we have Media for Social Change program that supports amplifying voices of forced migrants that are in most cases kept silent. And then why more programs is mental health and psychosocial well-being, where we support survivors in communities. That includes hosts and refugees access mental health services at family, individual. We heard from Mary, we are part of the National Working Group and other working groups. Currently, we are the chair of the MHPSS Working Group. I thank you very much, and may God bless all of you in this engagement.
Thank you very much. Now, we're doing very poorly on time, and yet we still have a few more people to come forward. So, REPSI will be followed by Safe Places and Find My, followed by Rotary. So, can With Rep C, 3 minutes.
Thank you. Good morning, colleagues. My name is Byamukama Michael. I work with Rep C, Uganda, as a National Association of Social Workers of Uganda, as the professional president for that association. REPSA Uganda, we are into both humanitarian and development work, and our niche is this. And of course, MHPSS is a right. And for us in the room, we are convinced, but the action moving forward, let's take it. And we are locally registered in Uganda as also a national organization, and we are glad and happy to be part. Thank you so much.
Thank you. Safe Places is right here.
Good morning, everyone. My name is Martin Amanya. I work with Safe Places Uganda in a bid to contribute for holistic healing. We are a private mental hospital that takes in admissions, but we also offer outpatient care. Our physical locations are in Chambogo, University Playground, Bujuko on Mitana Road. For more information about that, there are flyers about safe places that have been served on your tables. You can look at those, but also you can www.safeplacesuganda. All our socials on Twitter and on Facebook, Safe Places. Thank you so much.
So Rotary is keeping time.
Wasusotia. Good morning, everybody. My name is Pavel Repo, or in central Uganda, Chigozi, or in northern Uganda, Okello Pavel. Feel free to call me whatever you want. I come from the United States. This is my second home. I have the privilege of running an amazing organization called Find Mind. Now, we provide community-based mental health services in northern Uganda, primarily Agago district. Lift up communities that nurture. We would love to host you in Agago district. There are beautiful monoliths, rocks, the air is very clean, and we have a passion for community-based care. And at the moment, we're very passionate about primary care. So I'm at the edge of my seat, excited to hear the presentation. Thank you, everybody. It's an honor to be here.
Thank you, Fine Mind. Dr. Naku talked about of public health, and I'm tempted to think we could try another matchmaking, because Fine Mind and Strong Mind sound so similar. Yep. But we'll now hear.
Good morning. I'll stand on the protocol observed. Rotary, including walking, network over 1.4 million neighbors, friends, leaders, and problem solvers who see a world where people unite and take action to create lasting the globe in our communities and 7 causes that we emulate and carry out every year for more than 100 years. And just quickly going through them, we promote peace, we provide clean water, sanitation, save mothers and children, we support education, we grow local economies, we protect the environment. Our vision statement quickly. Together as Rotarians, it and take action to the globe, in our communities and in ourselves. Now, how do we come in this particular aspect? Every Rotary year, the Rotary International President comes up with a guiding theme. Rotary works, actually it's not just one, clubs that together make a district, and we are part of Rotary District 9213. That's just a number. Now in Uganda, we are 120 Rotary clubs. So our theme for this year is creating hope in the world. The other 7 is having a focus on mental health. So the Rotary International President had a very close family member that succumbed to a mental health focus on it this year. So that are in Rotary and the 120 clubs, we have a focus on mental health. And I'd just like to quote one thing he said, just 1 little minute. Many people have lost family members, many more have found their social network, especially had their education and development interrupted over the COVID-19 period. As a result, many people around the world are facing mental health issues, and yet seeking assistance is often from the truth. Reaching out for help is courageous, and continuing on a path toward wellness is even more so. As I close, on behalf of our district governor, I'm here today representing I'm in charge of all Rotary planning, implementation, monitoring, and evaluation for this year. So as I close, I take the opportunity to appreciate and thank the Ministry of Health, our partners, Butabika Hospital, this Rotary year. To continue to strongly contribute in the mental health programs, and our focus this year is on 3 areas: creating awareness, fighting stigma and discrimination to the community through the one going all over Uganda. We are very glad to be here. I'm not alone. There's a team of Rotarians. Please, could you stand up? They won't say anything. They'll just stand up and thank you. We shall continue. We pledge to continue supporting through advocacy in accordance with today's theme, mental health, a universal human right. Thank you very much, and looking forward to all of you joining us.
Thank you very much, Rotary. Again, I've been reminded of time. Tutapona will be followed by Thrive Gulu and Uganda Counseling Association, followed by Basic Needs, the Africa Retreat Center.
Thank you. Someone is reminding everyone of time. Juko Sara Zarango, Country Director for Tutapona. Conversant with Swahili, but basically Tutapona means we will be healed. We will be to get medication, but basically healing our emotional well-being. So Tutapona, we provide services in the refugee live. They've been affected more. Our communities and the people who are here and our brothers and sisters out there, they all need this kind of services. So for me, my emphasis today is let's not just talk about the right, but let's reach out to every one of us, because most times we are near each other, but we don't know the mental well-being of another person that is close to you until you hear a story of suicide, those issues. Let's make it for our mental health, but also for those around us. Thank you very much.
Thank you very much, Tutapona. Thrive Gulu. Close by, and Basic Needs Uganda, and UCA.
Thank you very much and good afternoon, colleagues. My name is Ola John Paul. I work for Thrive Gulu as a coordinator and counselor and also the secretary. Greetings from Thrive Gulu team and our county director who is not able to be with us because of other engagements. And Thrive Gulu is a women's-led organization and also youth started in Gulu district. The districts of Gulu, Omoro, Amuru, Lamo, Noya, but also planning to extend to West Nile districts with humanitarian, but our niche is mental health for our community. Thrive Gulu is very glad to be here and also very happy to work with government and so that together we are able to provide quality that we serve. At Thrive Gulu, we are doing not only mental health, but we also do GBV livelihoods. We do unintegrated programming such that our beneficiaries and communities from the work that we do. As a secretary to the National MHPSS Working Group, I know many partners are not yet part of the group because they do not have the information. Just like Grace has put it rightly, I want to share easily so that you don't labor looking for me, my WhatsApp number so that you're able to send for me your details. Persons, at least 2 people, if you could share their emails, their phone numbers so that I'm able to add you onto the WhatsApp platform and also to the emailing list such that you're able to receive all the information. My WhatsApp number is 0758 981 490. 81490. Once again, my name is Ola John Paul, double O-L-A, not with a single A, Ola. Yeah, so I think that is all for now. We are really committed to working with health and together we thrive, as we say in Thrive Gulu. Thank you very much.
Thank you very much, Thrive Gulu. I have decided, I've just here, so I'm going to request UCA to Basic Needs Uganda, and then ABBA Behavioral Health Services. Please come and join me this side on the stage. And then let's speak, let's keep it.
Time is already on our side. My name is Florence Adong. I work with Basic Needs. Basic Needs is a national organization. It was international, but now it's a national organization. But we have Basic Needs all over the world. We do a community facilities. We do create awareness to actually create demand for mental health services in communities. And we also build capacity of local government structures, especially health workers, VHTs, and others. And we also provide economic strengthening services to our and we advocate for better mental health. Today, as we celebrate the World Mental Health Day, I ask everybody to work towards seeing that government integrates mental health in its programming, and also we reduce stigma to increase. And let's make mental health services. Thank you so much for coming. I'm happy to meet you all.
Good morning. Elizabeth Okello, the president of the Uganda Counseling Association. Uganda Counseling Association is a professional body that brings together provide counseling, mental
This to see professional counseling embraced, and we do encourage each one of us to embrace professional counseling in whatever we do. We do have individual members and we do have members that start right from peer counselors and right up to PhD holders. We did celebrate 20 years a few years ago, and I just want to thank you all. I know several of the association. I just want administrative officer is here. If you need any information about UCA, she's there, or visit the website, check our Twitter space, Facebook page, and you get more information. Thank you.
Alebu Julius, and I'm an addiction professional working with ABBA Behavioral Health Service. We are located in Burindo, Chira, and we are a private mental health facility with mental health, addiction, behavioral problems. So you can find us on website www.abba.com, and I'm happy to.
Thank you very much, Julius. And I cannot preach water and drink wine, so I'll speak for Africa Retreat Center and keep it to 30 seconds. Africa Retreat Center is a treatment facility, mental illness and other psychosocial support settings. We have two facilities, one in Kampala, in Naguru, and another in Barara. And I will yield the 30 seconds of Africa Retreat Center to also talk members of the Addiction Prevention and Rehab Association who have not been able to come on stage, but it's a platform that brings together everybody who is in the addiction treatment and prevention space. So any APRAO member, so you may be recognized. That's it. My time is up, and I will now yield to Dr. Kenneth Kalani for the next segment. Thank you.
The person I'm going to introduce is yet to walk in. So, Gamba. So you can see that you're amused by the name of the person I'm about to introduce. I will not pronounce that name. I will leave it for him to pronounce it on his own. What that exactly means. Odokonyero, as I commonly know him, is my colleague and friend as well. But most importantly, he's my teacher as well. He is a lecturer university. He wears many hats as well. He is the immediate past president of Uganda Psychiatric Association, now called Uganda Association of Psychiatrists, UAP. He also see his physique, that is an athlete, and he was a professional rugby player. But most important, so today, join with me as we invite Dr. Raymond Odokonyero. Let's join hands together to welcome Dr. Raymond Odokonyero to give us the keynote address for this World's Mental Health Day celebration. And please, that name, that is very difficult to pronounce. You'll talk about it.
Thank you. Good morning, ladies and gentlemen. I hope you're not disappointed by the physique. You know, when somebody has set you up for failure like this, I think it used to be a lot better. Mental Health Day to you all. I am privileged to be here. The last time I had such an opportunity to speak at the World Mental Health Day commemoration was in 2014. And at the time I gave the keynote address on behalf of Professor Segane Musisi. I was filling in very big shoes at the time, and I had the luxury to say whatever I wanted, because at the time I knew that if you were to blame anybody, it was going to be the good professor himself. 10 years later, you've brought me back, and I'm sure you're waiting to eat me alive should I say anything out of place. Today I take full responsibility for what I will say, but if you know me, you should also know that I'm quite provocative. So if I should provoke you, especially mentally, please, let's settle the matters outside once this is done. So I thank you for honoring me with this invitation and for allowing me to give my ideas on what mental health as a right means. I'm so happy to be here to discuss a very important theme for this year. While I was reflecting on this theme, mental health as a universal human right, and our sub-theme as Uganda, my mental health, my right, I couldn't help but wonder, as mental health, is this a good thing? What does it even mean if the discussion today is about rights? Are we making progress? Possibly, yes. In what direction? Are we moving forward? Or is this some hoodwinking in which we are actually backtracking and not moving forward at all? So mental health as a universal right sounds like progress in a forward direction. And I'm happy to go through a few of the ideas that have come to me since. So, to discuss mental health as a right, as a universal human right, it's important for us to go one step back and appreciate what mental health is. And what it is, or what it seems to be, hence, or something like it, is that it's a living discipline. It's the everyday things that we do from the moment of our birth to death. Mental health is not just mental illness. Mental illness is the extreme manifestation of our mental health. But oftentimes, we have put a divide between what is mental health and what is mental illness or mental disorder or mental disability. And it seems like these things are two sides of a coin. Yet the truth is that they are one and the same. Perhaps like a pendulum, they are swinging up and down the pendulum. So to understand mental health, perhaps we need to look back to this continuum here. That it is a very fluid concept, which ranges from you having some wellness in the green, to you being ill or subjectively feeling that something is not well with you in the red. So mental health is the entire spectrum, whether you are okay or you're not. And all along this spectrum, something can be done. Some sort of intervention can be done, whether you're in the green or in the red. As a psychiatrist, I have been forced into that corner with the extreme red, so that I am dealing with the most severe forms of mental disorder or disability. And that may be misuse of my abilities, because mental health really is an entire continuum, such that in the morning you may wake up when you're in the green, and that is before your loan shark calls you at 1. And now whenever your phone rings, your heart races. By evening, you're completely well seated in the red zone. And that is the nature of mental health. It is not a fixed position that you belong there, and therefore there is them and there is us. And out here in the public, somehow that is how it is viewed, that there is them, those with mental illness or disability, and then there is us, with the assumption that the us are the normal ones. I'm here to disappoint you. There is no such thing as normal in this discussion. There is mental health. There is no normal, or abnormal for that matter. Because no matter where I fall on this continuum, I am normal. I am a normal representative on the continuum of mental health. Should it matter then that I'm seeing the world a little bit differently, or I'm hearing some voices? Would that make me worse than you, who hasn't heard any voices, or who sees the world in your own unique way? Possibly shouldn't. Before I get off this slide, I would like to just draw your attention back to that very screaming headline that most of you refer to these days. 14 million Ugandans are mentally ill. Up to now, when people learn that I'm a psychiatrist, the first question they ask me, so is it true? That's the first question. The second question, am I one of the 14? Now, usually my answer is very irritating to them, because my answer is usually that that is a total underestimate. And if you were to look at this continuum, you would understand that none of us is safe. That we are all on the continuum. As long as you have a brain, that is. So, to discuss mental health as a right, we must address the issue of what it is in the first place. In Uganda, what is very clear is that we've come to terms with what mental illness is and what leads to mental illness. At the extreme end of our continuum, in the red zone, we have studied that area very well. We understand it, what the symptoms are, what the signs are, how to treat it, what the prognosis. We've got that part to a large extent because we are still leaning on the biomedical model. The biomedical model says that diseases have caused some sort of lesion in some part of your body. And because of that, now you have signs and symptoms. And if you have signs and symptoms, then we should treat you. Now that's where my problem with the whole of medicine comes. Because medicine in its entirety teaches us how to identify things that will kill us. That's all. So it's trying to tell us not to die. The whole discipline of medicine. it forgot to tell us how to live. Because not dying doesn't mean I'm living. And somehow we are trying not to die. Don't eat that food. You might get cancer and die. If you don't jog, you'll get hypertension and die. If you don't do this, we are scared out of our wits. What should we eat? What shouldn't we eat? How much exercise is good enough? How much is not? So we are kind of in this game where we are playing hide and seek with death. And that's a little bit tragic, if you ask me. Mental health and psychiatry and all other disciplines that deal with the mind had come from a different premise. And that premise was to teach you actually how to live. We are not trying to tell you not to die. Unless you're very highly suicidal, of course. Please don't die. But otherwise, mental health is telling you, take a vacation. Go and sit with your grandmother and have a chat. Talk to your best friend. Take a cup of coffee. Just sit back, put your legs up. Now, when you come to our offices and we tell you that, you're like, oh my God, this doctor, how can they say that? I hope there are no people under 18 here. Because once in my private practice, the most logical advice I could give my client was go and have sex. And he said, what? What, doctor? I said, yes, go and have sex. Plenty of it, safely. It's shocking. It's shocking for him because all the hospitals are not telling you how to go and live. They're telling you how to go and avoid dying. Mental health is different. And that's our unique advantage over the rest of medicine. And something that perhaps we should talk about a little bit more. So because we have borrowed on the biomedical model, we have focused too much on mental illness and forgotten mental health as to be mentally healthy. And perhaps that's the direction we need to start to think about. So, but to do that, we must go all the way back to the beginning. All the way back to your whole life, from the moment of your birth. Because to understand mental health and its development and the problems that can come from it, we need to understand the human lifespan. Because something can happen all along your lifetime. All the way from even moments before you were born to even when your mom met your dad. Your mental health had started to come into play. And all through your life, something is happening, which is a normal part of living to you, that informs where along the continuum of mental health you will belong. So right from the moment we are born, you may not be able to see those, but it starts from birth on the extreme right. Infancy and childhood, things are happening. Being born healthy with a normal body weight is crucial to your mental health. Acquiring language skills and other social skills during your infancy. Developing impulse control in infancy and childhood. And it goes on and on through to adolescence, to early adulthood. Now, I'll pause at that slide there and say, whatever can go wrong in mental health is likely to happen on that extreme right, from your birth to early adulthood. In fact, the World Health Organization estimates that nearly 80% of all mental disorders that you will suffer from later in life, it started before you were even 14. The insult occurred before you were 14. So that's how crucial this lifespan study should be. This is why we need to pay more attention to this category of people from birth to adolescence. The things that they are going through, they should take utmost importance because we are building their mental health at this stage. But of course, your mental health doesn't only depend on birth to 14 or birth to 24. Even much later after 24, in adulthood, these days I hear the term adulting as a verb, which can become present continuous. So adulting can happen to you. We have big people problems. If you have become a parent, then you have parenting problems. And you'll have problems of parenting all through. Problems of parenting a newborn. You're worried all the time whether you might turn and smother the child. And then they become toddlers and they're running all over the place. And then you worry that they may get hurt, fall in fire or in water. And then they become adolescents and they become your enemies. You start fighting. And they are very expressive. I hate you. You should not have given birth to me. And then you find yourself thrown into another space that you had not seen coming. And on this
Yes, thanks for joining us. For those who've just joined us, Chintumte Sasila Seniors, my name alongside Namali Genesis, and we're still going on with the celebrations of the World Mental Health Day. Now, we've learned that mental health is for every one of us, and everyone is prone to mental disorders or challenges. No one is exempted. Actually, the professors like if they go through statistics, they can check that mental challenges begin as little as 14, as a teenager, early teenage age, puberty age. Can you imagine? So this is something very serious that needs to be given undivided attention. But also, what are the other things that he was talking about and other players have been talking about? The partnership. We need to come together if we are to seize this humongous challenge. We need to partner together. It is you and I. You do for me, I do it for you. We need to come together. But also, it calls for a hefty investment. Now we're talking about finances. So if we are to do awareness, if we are to get medications, if we are to reach each one, reaching one, it calls for human effort. It calls for hefty finances injecting. It calls for our own determination. So we are going on with these celebrations commemorating the World Mental Health Day and celebrations there with the theme my mental health, my human right, or my right. So it is your right to be mentally stable. It is your right. Now, mental health attacks not your breast, not your body, not your palms, not your stomach, not your feet, your head. So something very, very, very significant which is happening. So later on, we are still anticipating and waiting to hear from the Permanent Secretary of the Ministry of Health, Dr. Diana Twini. We're waiting to hear from also Dr. Hafsa there to come and give us their speeches, and I think we'll call it a day, but we are still here. Namade, anything there, you've heard it from the professor and still going on, still speaking, and later on we shall be back giving you more details concerning what is going on at Silver Springs, Bugolobi, as we commemorate and celebrate this amazing day.
Earlier on, during 10th of October this year, as we were celebrating the World Mental Health Day, which officially it was on the 10th of October this month, to be precise, the World Health Organization released a toolkit that is supposed to enable pupils, that is abana abato, okusobola okulaba nga they mitigate mental health. Now you can go to World Health Organization website and be able to download the toolkit, especially if you have pupils at home. Those are basically children in primary level here in Uganda. We can subscribe to that. So you can be able to subscribe to download the toolkit, read it. Now this toolkit is basically established to help your pupils understand the importance of mental health, to understand how they can mitigate mental health disorders, how they can manage their well-being as people, and as they can to enable them grow up into mentally well organized individuals. Now that is very important, especially for us here in Uganda, where our youngest generation, our biggest generation and population at that, is comprised of the youth, practically from the age of 15 to the age of 25. So yes, World Health Organization, that is the best it offered us this year. Of course, it came along with so many other things. There's actually the primary toolkit, there's a secondary toolkit as well, which is it keeps on upgrading. So you can start with the primary toolkit, and also you can upgrade later to the secondary toolkit after you have gotten the basics of it. But it is World Mental Health Day here, and we are celebrating it nationally here as Uganda. We're commemorating it today, and we are raising awareness on mental health, and we're saying mental health is your right as a person, and for you to be able to establish that right and respect it starts with you as a person. But it is a few minutes to midday, and we will take a short break. Then when we go back, we'll be diving more into mental health and creating awareness and letting us know how we can produce a more productive generation.